On health news, yesterday was announced that the review of MediShield Life will enter its second phase of consultations. It's already conducted focus group discussions with over 500 people. 3 subcommittees will now address very specific concerns. First, we'll study the benefits of the National Medical Insurance Scheme. There you have it. Second, we'll study how to bring the uninsured into the new universal plan and how this should, of course, be paid for. And the last subcommittee will study how to improve the oversight and regulation of integrated shield plans. And we have in studio Dr Chia Shi-Lu, member of the Government Parliamentary Committee for Health, to discuss the issue. So Dr Chia, always great to have you in studio. Thanks for coming today. So first phase of consultation so far seemed quite encouraging. People support the need for lifelong insurance, but what's your sense of this? Is there also an understanding of what it means for premiums going forward?
Yes, I think what has come out from the first round of consultations and even from my dialogues with various residents and just interested parties is that I think almost everyone welcomes this move. It's going to be a pivotal moment for healthcare in Singapore. But, there is this perennial question of cost that's come up. So I think now we're moving to the second phase where we actually dive down into the nuts and bolts, and it'll be very interesting to see what these groups come up with.
So one of the issues is how to bring the uninsured into the new universal plan. Yes. This, I think, is the most tricky debate because it's a question of who's going to bear the cost, isn't it?
Yes, I mean, that is a key feature of MediShield Life. You're going to get universal coverage for everyone. And I think it will stick to that, It means everyone will get it. That means those who are presently uninsured or those who are excluded because of some conditions. I think this question about premiums is going to be a tricky one. That's why you actually have these 3 committees or 3 subgroups looking into it. First, there is the question, obviously, of what benefits will be covered. Number 2, there is this question about actually the large number of people who are already on integrated shield plans. These are actually above the basic level, and they do have a lot of, well, I wouldn't say frills, but a lot of additional benefits that are not covered under the current basic MediShield plans.
Feedback so far is that Singaporeans are very worried that the elderly and the low income will not be able to afford these higher premiums, and they want the government to step in. What's your take on that?
Yes, I think when I was here last year, we talked about some of the recommendations from the GPC on health. I think one key consideration they've had was that the elderly, the MediShield and the 3M system really came into being, I think, in the 1980s. So for Singaporeans who exited the workforce or had, around that time, they would actually have very little accumulated in their MediSave, and they may not have been enrolled in MediShield. So that is one. The second group, of course, would be those who are of the lower income, and they would have, smaller accounts in their smaller amounts in their MediSave accounts. So these are the 2 vulnerable groups, which we hope that this new MediShield Life program will specifically address. But we come back again to this issue about premiums. So I think with the announcement of the Pioneer Generation package, this would address the concerns of most of the elderly. This does leave a certain segment of the population, typically either those who are unemployed, not employed, or from the lower income groups who may not have enough in their MediSave accounts to help offset these costs of premiums, or may not even have cash in hand.
So, Doctor, another topic that's been the focus of huge debate is the argument for prefunding, which means you pay higher premiums when you're young and working. And some people have this misconception, or that it means that young people are subsidizing older people. What do you have to say about that? Yes,
I think that has engendered quite a lot of debate. I've had many queries by email and by just people stopping me in my constituency on the hospital asking me about this. There is a bit of concern from the younger Singaporeans that this is a form of cross-subsidy. So I think it's important to recognize that this is not a cross-subsidy. That means the premiums that the younger account holders may pay actually goes into their own pool. So there is actually no cross-subsidy involved. However, we always, the whole concept of pre-funding comes because we would like to reduce the load of premiums on account holders of Singaporeans as they grow older. Because currently, the older that you grow, then the higher the premiums are, but your earning power actually drops as you grow older. So I think this proposal was mooted to sort of try and address this problem.
All right, thank you very much, Doctor. A lot of issues we'll still have to talk about down the road. Hope to have you back soon again. Thank you very much.
Thank you.
And that was Dr. Chia as consultations for the review of MediShield Life enters its second phase. Let's have a quick look